As the seasons begin to change and we enter our winter months, health officials are concerned an increase in patients with the flu could be our reality this winter.
I sat down with Providence's Kristen Filer on how this year, more than ever, a flu vaccine is something you should consider.
As the seasons start to change, so do our body's immunity when it comes to the flu.
This season is now more important than ever to get the flu vaccine. If you've never gotten the flu vaccine, this is the year to get it.
Filer saying getting the flu increases your risk of pneumonia, which can land you in the hospital.
We can prevent you from coming into the hospital. We want to do that because right now, more than ever, our hospitals are overrun. We don't have any room. So keeping you out of the hospital, keeping you from having complications of the flu.
As the weather gets colder, your chances of getting the flu only increase. And with an already ongoing pandemic, this is worrying health officials.
They're really worried about, as well as a lot of doctors and researchers are worried about, a twindemic where we have the flu pandemic and we have the COVID pandemic, and you combine them and we're not too sure what we're going to do with all the patients.
The flu vaccine, which has been around for decades, changes every year to prevent the most dominant flu strains from making you sick.
This year's flu vaccine is going to try to protect you from at least 4 different strains, 2 different influenza A, 2 different influenza Bs, which are the most popular ones. The virus evolves very quickly, so we want to make sure that every year you get a flu vaccine.
It lasts for about 6 months and takes about 2 weeks to fully kick in for your antibodies to start building back up.
Right after you get the vaccine, you get a couple weeks where you kind of feel a little weird. You got muscle aches and you got fever. And this is just your body's reaction to trying to build up some of those antibodies. So it's not that they gave you the flu, it's just your body's reaction trying to build it up.
Filer says kids too should get a flu vaccine.
It significantly reduced their risk from dying from the flu. So it is safe to get the flu vaccine 6 months and older, even pregnant women. Very important to remember that you got a 2-week window and it lasts about 6 months, and you want to make sure, this is why we really encourage people to get it every year.